into that grave. And that was it. I was dying. I called my wife. I was stuck in traffic going to work. And I called her and I was like, something's wrong. Something's bad, bro. I didn't know any better. I think I'm dying. And at that time, our son was very young, and all I could think of was him. That's what I always pray. I pray that anytime I get to speak to like a group, I've always prayed one person, just one person in that group would hear something that they could then change their life. And that's really all I ask for.
Welcome back to the Faith, Fitness, and Chronic Illness podcast. I'm your host, Andrea Barrick, and today I have Dr. Jonathan Locke. We are going to be discussing so many things, but a little background on him. He's been in healthcare for over 25 years. He is a chiropractor, and he loves to treat musculoskeletal conditions and has been on a nutritional journey himself, dealing with autoimmune disease, specifically psoriasis. This has led him down the functional medicine path, and he is soon to be completed in functional medicine. He's also just got certified in dry needling, I believe. So he recently discovered that the diagnosis of psoriatic arthritis actually turned out to be an underlying Lyme disease infection. He then started to realize what was important to him in his life, which was his family and his freedom. He decided to leave the cookie-cutter corporate chiropractic clinical world and start his own functional wellness practice to be able to serve his patients the way he and his clients decided was best for them. I really hope you guys enjoy this podcast. He is actually my personal chiropractor, and he has a lot of wisdom and insight, and please let us know if there's any way that either of us can serve you. And I hope you find this podcast encouraging and educational. That's awesome. Well, welcome to the Faith, Fitness, and Chronic Illness podcast. I have Dr. Jonathan Locke here. Fun tip, he's actually my chiropractor. And he saved me last month. I had a rib out or something. I don't know. I came to you crying because I could barely move. But you have had a history with chronic illness. So I wanted you to come on my podcast and talk a little bit about that. But first, I want you to share how you kind of got into chiropractic care and why.
Man, there's just right there in that question, there's so many long stories that I can think about. The truth is, I've always been kind of a self-proclaimed nerd. When I was a kid, my cousins bought me a shirt for Christmas, and it had my picture, like my school picture. And at the bottom, it said, I'm the studious type. And I was too young to understand what studious meant, so I had to ask. And my brother's response was, you're a nerd, that's why. And then I understood, okay, that does fit my personality, because even a young child, I was just always reading and looking at stuff. I loved the library and just would go into the library and I would pull out books. I remember looking at anatomy books when I was probably freshman in high school. I loved the library so much. I actually worked in the library in elementary school. And looking at these books, I just was amazed by the human body. I wanted to know, even at that young age, like why we were the way we were, how our body worked. And I didn't understand things about females, so I wanted to know about that too at that age. And it just kind of stuck with me. I came across Muscle Mag magazines and the muscles that the people had. It's like, wow, that is really cool that they can do that with their body. They can essentially manipulate their body in a way that they can maximize their growth, their potential. And just started looking at health and nutrition through reading really those Muscle Mag magazines. And I remember that about like 12 years old. So, not a great athlete. I was young. I started school when I was like 4. I graduated high school when I was 17, started college when I was 17. So I always was a little younger, a little smaller than my classmates, I felt like. So my sports skills didn't come on until later in life. But I started lifting in my backyard and really enjoyed that. I was riding around campus one day. I didn't know what I wanted to do in college. Actually, that was about the time computers were coming out. So I just thought, man, computers are going to be around forever. So maybe I should go into computer science. That sounds cool. I'm a nerd enough. I can learn that. But it drove me crazy. Staying up late, programming computers. I don't know if it was my teachers or just I didn't enjoy it. And I remember riding through campus one day and I saw this sign and it said Sports Medicine Center and an arrow. I literally stopped, pulled over, parked my car, got out, walked in, looked around in the building, couldn't find anything, but I heard somebody talking down the hallway. And I found my way into the athletic training room. And I just walked right up to the head trainer. I was like, hey, I saw the sign out there about sports medicine clinic. I want to learn more. And he directed me down to the real office. And I found out that we had an athletic training program. At that time, the athletic training program was a dual major. It was athletic training and education. Like you basically became a coach. So I dropped the computer science and jumped into the athletic training. And then they made us choose one or the other because they realized the hours were so long. You had to get so many volunteer hours with both of them that people were extending their career, their college careers. So it took me 5 years to finish with that. Probably I think it was my last year of school, two things happened. One, I was thinking, even as a college student, man, I am spending a lot of time in the training room, traveling with the teams, on the sidelines. And I'd look at my friends and go, these guys are sleeping in till 10 or 11 o'clock. Yeah. They're partying, all that stuff. I'm like, I can't party. I got too much to do. And I knew kind of then that I don't know if I want this to be my career. This seems like a lot of hours. And at the time, athletic trainers were not getting paid a whole lot. So I started looking into other things like orthopedics, physical therapy. Those were the two main things I was looking at. And then our assistant athletic trainer, he was a physical therapist and an athletic trainer. He hurt his back. And we did everything we could think of. He came to me, he's like, what do you think we should do? And we were rehabbing him and he just wasn't getting better. And one day we're sitting there at practice and he leans over, he said, I think I'm going to go to a chiropractor. I said, do it. Let's see what this is about. And he went and he called me on the way home. He's like, you have to come with me and check this out. He's like, I already feel better. So I called the guy up and he said, sure, come on over. And so I went and shadowed him for like maybe 5 hours one evening. And Andrea, I never had seen people walk into a clinic feeling one way and walking out feeling a totally different way. There was nothing that we could do. I never saw the orthopedist be able to do that, even with medication. We couldn't do it as athletic trainers and physical therapists. It was a process of rehabbing these people. I remember this, I don't know, she's probably 86 years old. This lady comes in and she's literally bent over. Doc, you got to help me. You got to help me. Of course, I don't know what was going on. I was just hanging out. And the doctor adjusts her and she sits on the edge of the table and stands up and goes, I feel great. Bends over, touches her toes, leans side to side. I'm like, oh my gosh, this is amazing. And he asked me, he said, you ever been adjusted? I said, no. He said, lay down. I didn't tell him a single thing. And he started feeling through my spine. And at that time, I had this burning numbness sensation that would happen in my kind of lower middle back. I know where the injury came from because I was never a good fisherman. I would always fish for squirrels. And that means that you get your lure caught in the tree. And that's what happened to me. And my dad was busy with my brother. And I was like, Dad, my lure. He's like, you're going to have to get it. So I pulled a cinder block over and stood on a cinder block to get my lure out of the tree. And it was a slight decline to the water. And that cinder block rolled out from underneath me. And I landed on top of that cinder block right on my spine.
Oh, man.
And within days, it was burning and numb in that area. After it had completely healed up from all the scrapes and everything, I would still get this burning sensation. I would scratch it. So much it would actually start to bleed. And he went right to that spot and adjusted it. And that numbness immediately went away. And he adjusted what I thought was my shoulder at the time, but now I know he was adjusting my upper ribs and my lower neck. And I also had some problems there, like T1. I always had this burning sensation in my upper back. I would lay on a bench if I could, and I'd grab my head and I'd pull down like that, get everything to open up. So I was a self-manipulator too before I became a chiropractor. And I just wanted some relief. He adjusted that. I stood up and I was like, oh my gosh, this is crazy.
A brand new world.
Yeah, about 20 minutes. I remember timing it because, again, I'm a nerd. So I remember thinking, okay, how long is this going to last? About 20 minutes, I started to feel a little bit of the tingling and numbness coming back. But I was smart enough at that time to know, okay, this is something I'm going to have to. Well, unfortunately, school and everything in life, I never went back to the chiropractor again. I didn't get another adjustment. My second adjustment in my life happened at chiropractic school. So there was years in between there that I went to work. I graduated. I was an athletic trainer. I worked at the high school level. I worked with physical therapists in the physical therapy clinic. I could see that world was not where I wanted to go with PT. At the time, there was still a lot of control from the medical doctors. None of the physical therapists were doctorates. There weren't doctorate programs.
Yeah.
And I truly think our orthopedist at college I don't think he was a good orthopedist. I couldn't understand why he was wanting to do surgery on all these 17, 18, 19-year-olds. He didn't ever really seem to care what was going on other than let's get him in surgery, let's get him in surgery. And that disappointed me. I think I could have been a great orthopedist, but I don't know. Like, I don't mind cutting on things. Like, I'm an outdoorsman, so I've harvested and cleaned plenty of animals, but people are a little different, I've overcome some of that now. I just got actually working with dry needling. So that was a little nerve-wracking at first. Yeah, I just did that.
Yeah. How was that?
It was awesome. Going in, my experience was poor. I had received dry needling myself for an elbow problem I was dealing with just a few years ago. It was not fun, is the only way to explain getting that technique of dry needling. And so for years, I hesitated in getting it. I knew there were some benefits just from talking to people, but I found this group and they're teaching neurological dry needling. So it's very different from the other technique, which is essentially you're pistoning the muscle in a trigger point to exhaust that muscle. And it's really uncomfortable. This is more, you're just inserting that. This is basically an acupuncture needle. You're inserting that into the area of the nerve innervation to the muscle to break what's happening in that muscle so that the brain and the muscles can reestablish that communication. Yeah. And it was very comfortable. There was only a couple times where I'm like, ooh, that's uncomfortable. But they were areas where I knew that those muscles did have problems. I really, throughout the whole weekend, I just got more and more excited thinking about patients that would benefit from it. And I remember the doctor teaching it. I was talking to him. He was like, I said, well, when should we start? He's like, Monday. I was like, maybe Tuesday. He goes, no, start on Monday. Well, Monday I took off. Tuesday I was just there with a couple patients. But Wednesday I did needle my first patient, and it went really well. So I'm excited to be able to offer it as another form of treatment that chiropractic may not benefit that person. Not necessarily that won't benefit them, but that
just another tool to help. Yeah.
And this particular person, I told her, I was like, I would not adjust you because there's some red flags there without some x-rays and some images. But we can do dry needling. And so we went with the dry needling, and she's already getting results. I could see her results while she was in the office.
Right. So the muscles probably relaxed in her.
She was having TMJ problems, and she couldn't open her mouth more than like a finger's width. Wow. By the time she was leaving, I could see the motion opening up in her mouth. And before she left, she tried to stick 2 fingers, couldn't quite get 2 fingers, but there was definitely a difference there in just one session, and only used like 4 needles on her. So it was.
That's so fun.
Yeah. I've got some other techniques.
Yeah, I shared my dry needling experience with you, and it was pretty intense. Yeah, so share, because I know you have the microcurrent, or what else do you have in the
office? I got some electrical stem units, some TENS units. My favorite right now is shockwave. I wish it had a different name because shockwave just seems
scary,
terrible and scary, but of course dry needling does too. So I've got these scary sounding therapies. The real full name is like extracorporeal radial pressure shockwave. So what it does is it creates a mini sonic boom. It was based off of, using, like, I think the term is lithotripsy, where they would use the shock waves to break up kidney stones.
Right.
And they started expanding on that type of research and realizing how much it could help. The shock wave is actually what saved me my elbow. My elbow was getting so bad I couldn't hold a phone to my ear. I couldn't hold a plate of food. I couldn't carry groceries. I couldn't hold my son. It was really a challenge adjusting people with an elbow like that. I was doing cold laser. I was getting dry needling, massage. Finally went to an orthopedist. They're talking about PRP injection. They want to try really high doses of anti-inflammatories, which I did because I didn't have any other option. And somebody mentioned shockwave somewhere along the way. And one afternoon, I just started looking at it, reading all this research and just study after study about benefits and improvements, especially when it came to tendonitis, bursitis, calcifications in tissues, arthritis problems. And I was like, man, I'm going to try this. So I called a couple of companies and I got one of them to agree to come do a demo. I said, if I'm going to buy something like this, I need to see what it's like. Mm-hmm. And the guy came up from Atlanta, and the first session he did my elbow. And I was like, oh man, that's hitting it, So it creates a little sonic boom inside of the head, and that sonic boom is transferred in your body. We use a gel, and that sonic boom literally breaks down scar tissue. It stimulates collagen and fibrin formation. It stimulates the mitochondria and ATP. There's so many things that it's done, and I've used it on so many different conditions, and a majority of them, I'd say 98% of them, have had immediate benefits within a few sessions. He did that one session on me. It's like a Wednesday, and I think it was Friday. I was walking around carrying my son. He was 2 at the time. My wife asked me to write something down. So I switched him to my left hand. I picked up a pen. I started writing, and I stopped, and I looked at her. We looked at each other. It's like, oh my gosh, that's the first time I've held my son in my left arm in probably a year. And so I knew right then there's definitely something going on here. I got another company to come and do a demo too before we actually bought one.
Yeah. Can you use that for like plantar fasciitis?
Yes. Yeah. I've got somebody right now. I'm using it for plantar fasciitis.
Okay. I might talk to you next time about that.
Yeah. So now I know I can also use some dry needling, right? So This particular patient right now I'm working with, lots of problems, talking to her doctors and, talking about anti-inflammatories and maybe injections and talking about surgeries. I said, before you go that route, let's try this out. The first session, she came back. She's like, I went an entire week without foot pain. The second session, she missed her appointment or had to reschedule. And it was probably 10 to 14 days before she came back. She's like, okay, it started coming back. So we did it again. And then I think the third time she's like, I don't have any pain, but I'm having a little numbness now. So we changed some things up. But while I was dry needling, learning some things about needling the nerve bundles between the toes, I thought, I think this is our next step. Address the tendinous portion of her plantar fasciitis, but she also has some neurological components. So now I can use the dry needling, which I will do on the next visit, to hit the nerves in the lower part of the leg and in between the toes, and see how that does for her. Sometimes, when we're in practice, we don't call it curing, right? We don't call it hunting or killing, right? We call it hunting, we call it fishing, we call it practice because we're practicing on people. And sometimes it's an experiment. You don't know how somebody's going to react to some kind of therapy, but when you have these options,
it's nicer though, because the therapies that like you and I prescribe are safe though. Like if I tell somebody to eat something, the chances of them having a reaction are very slim. Whereas if I'm prescribing them a medication, read the inserts and it's like death could occur. It's like
100% of drugs have side effects. Yes.
So, and even if you don't get the terrible side effects, there are still some sort of side effect to taking pharmaceuticals, because the way drugs work is to manipulate the body to suck nutrients out of another area to do what it's supposed to do. And so it'll deplete you of nutrients. And then you'll end up with another disease because you're nutrient deficient in something else. And then you'll end up on another drug. And it's just like this ongoing. And it's really sad to see people you probably get a lot of patients that are on like a handful of prescription drugs, and it's just really sad to see. But I'll definitely talk to you about that. I've always had feet issues. I don't know why. I think I wore really tight shoes a lot growing up, and it's kind of like made my feet. So I've recently switched to more of the barefoot shoes, and I've seen a lot of benefits. But now I stand all day, so that kind of still bothers me. But so you tell me a little bit about your Lyme and chronic illness experience. When did that start happening, and how do you feel now?
I feel good now, to answer that part.
Good.
Sore now, I'll talk about all the pain and stuff, but my soreness now is because of the new type of workouts that I'm doing and life in general. I feel like that's the soreness I should have, right? Not the soreness that I was dealing with, which I'll talk about. So, I've actually had at this point now, kind of a lifelong chronic illness, immune condition. When I believe I was 19, I was in college and got a spot that came up on my arm, my forearm, and went to the doctor, and he didn't know what it was. I realize now, but at first he goes, let's burn it off. I said, okay, I'm 17, 19. I don't remember how old I was, but
Yeah, fire.
Yeah. Well, it was the, what they used to cauterize.
Freeze.
Yeah, freeze. Yeah. So
yeah.
froze it, and it came back in a circle around that spot. And I said, okay, well, we're not doing that again.
Oh no.
So it just damaged and irritated the skin. So for years I had, that froze burn and then the circle around it. I think I was 21 after I graduated. I graduated college and got insurance, and then went to a dermatologist, and that's when they told me I had psoriasis. Well, at that time there were not many options, sprays and topicals and things, and we tried some like injectables, but there was risk of collapsing the skin, right? Like the skin matrix literally collapsing. Well, that happened whenever they did an injection one time.
Oh my
I
gosh.
literally got an indentation in my leg from the collapse in the skin matrix. And, again, at that point, I was developing that mindset of, I was still, sort of allopathic based in the medical mindset, but I'm starting to catch on like, okay, they're experimenting on me and I don't know what this is, but there's got to be some other kind of option. So I started developing that mindset even before I went to chiropractic that, we are responsible for our own health and not our doctor. Probably another story we can get into about my experience with the physician. He's literally told me, he's like, if you're not sick, I can't help you. I said, but I came to you to make sure I'm not going to get sick. Again, I was probably 18 or 19. And he's like, well, if you're not sick, I can't help you. I said, okay, then I'm responsible for my own health. So just back to psoriasis, decades worth of that, and just trying to manage it on my own, trying different types of ways of eating or supplements, and just always studying about it. And back then there was really not much research or talk about the gut microbiome as we know in past 5 to 10 years. It's really started to explode, and I don't know if we'll ever know enough about our small intestine. It's just hard to research and investigate that area. I still have psoriasis. I still have lesions. It's not gone away, but I haven't been dedicated enough to try like an extreme limitation diet. The best I've ever done was like a raw vegetable cleanse, and I think I did that for maybe 2 weeks, and then started adding some meat back in, then slowly started cooking my vegetables and kind of working through that. Of course, I lost weight. I don't know that it was long enough to change anything with my skin. I'd say dietarily, the only time I really had a major change was when I was just being real diligent on, no gluten, no soy, no dairy, very little sugar. And I wasn't really paying attention to like the types of carbs or anything. I was just, if I can't eat bread or can't eat, soy, then I can eat, rice and potatoes and all that. So I wasn't really paying attention to it. During that time, the lesions changed. Is the only way to describe it. They were, like on my thigh, there were some really large plaques there, and they kind of, broke up a little bit and became more, specks than they were one giant big lesion. You and I have talked about doing carnivore, and I've heard lots of great results with carnivore. I keep telling myself I'm just going to eat meat, but I'll start like breakfast, I'm good, lunch, I'm good. But by dinner time, it rolls around, and whatever my wife has made is usually what I'm eating. And then it's like, okay, well, that kind of blew it. Let me try starting again tomorrow. And that's just not, the best way. I know lots of people probably struggle with diets that way. Going through that process, I started to have this strange fatigue and migrating pain. Psoriatic arthritis will affect specific joints. And it will destroy those joints. I remember in chiropractic school looking at those x-rays going, wow, how does that person even move? And it just eats away your joints. So that's always been a concern of mine, especially as a chiropractor. So I've been concerned about my joints throughout my entire career. But I'd say right after the pandemic is when most of this strange migrating pain with this extreme fatigue started. And at first I thought maybe I had long COVID. I remember talking to a couple of my buddies, and the one guy's like, I can't remember, maybe he's 55 or something. And the other guy's like 60 something, and he's about, to retire. And I was standing there, we're doing some work, and I was looking at them. I was like, I can't hardly keep up with y'all. Something's wrong. They both looked and they're like, yeah, we're not fit guys, and you should be able to keep up with us. And I was struggling with that. And so it'd be this thing, I'd wake up in the morning, I'd literally lay in the bed and I would do sort of an assessment. I'd run through and go, okay, what joints hurt? Wiggling my toes, wiggling my fingers. What joints hurt today? So I know how I can modify how I'm going to work with my patients. And it about every adjustment would hurt. I'd adjust somebody, bam, I get this pain. And I was just going through it. And it started to affect me mentally because I'm getting frustrated and getting depressed. I'm like, is this something that I'm going to be dealing with for long term? Is this related to all the, recoil effect that happens whenever we do an adjustment? There is a bounce back when we're adjusting people.
Right.
So I couldn't tell if it was from that or what. And then I was just so tired. The only way to explain it was I felt like days I had the flu. And I would even say to my wife, I might be getting sick. And like 3 days later, I wasn't sick. I didn't have the flu. The fatigue would go away one day and I'd wake up and go, what did I do? I feel great. What did I do? And so I was trying to analyze things, and it would show up and be like pain across my shoulders. And then the next day it'd go to my low back. And
that's like classic Lyme right there.
Yeah, it'd be in my legs, and it'd be my feet, then go away, then it'd come back. And my wrists, and I'd have this swelling. I just wake up and boom, my hands were swollen up. Within that process, it was a little before that too, I really started self-medicating with alcohol from a numbing stance and, emotional perspective too.
Is that why you have all those liquor bottles up there?
Those are from way back when. I don't drink any of those. We talked briefly about that. Yeah. These are all collectible bottles for people who actually watch this.
Yeah.
Got into collecting Jack Daniel's bottles. They have so many memorabilia type bottles. Some of these are antique bottles where they've got gold medals and things like that from like
the
1800s World Fairs. Some of them are from Europe that you can't get here in the United States. Some of these, like I'm pointing up here, there's a 6-pack of beer. Jack Daniel's actually produced beer for a while. And I got into it because of my mom. My mom had a small Jack Daniel's display. I don't know if it's up there. You can't see it. I think it's over here out of the screen. She had this bottle that she would never touch. And she had a couple of other things. I think this plate right there was one of hers. And she had it like displayed. And then I realized that the Jack Daniel's distillery was only like 45 minutes from where I was born and my father lived. So as I got older, I just would go down there and we toured it. And I said, man, this is great. And so I bought my first bottle. And then I went into town and bought some other memorabilia. And it just created this monster of... My friends would joke and be like, are you going to Graceland? And they meant Lynchburg, Tennessee, not Graceland for Elvis Presley. And so, yeah, I would go, any bottle they had that was commemorative, I'd buy from the distillery. So the majority of these came from the distillery, some from downtown, some from on, and some of them, people gave to me over time. So it got a little excessive because there was a time where I was moving and I just had them packed in boxes. And I didn't realize how much I had until we moved into this home and I started unpacking them. And I said, man, I got to put these on a display somewhere. And so then, I started putting them up, and there's more that you can't see off to the side here. And I've had to give away stuff and just take some down. It got a little obsessive. So all that is not drinkable. They are drinkable.
Right.
But I don't drink them. I bought them specifically with the intent of not
keeping
them.
Yeah.
But
so you started to use alcohol to self-soothe and
I got into beer big time.
Okay, interesting.
I got to the point where you'll in your career, you probably talk with people and they go, Andrea, I just can't give up bread. I love bread. Well, that's how I was with beer. Like I loved beer. I love the smell of beer. I love the yeasty smell. I love the bubble of it. I love to go and do tastings and then, bring out home whatever I had. But before that, it was more of like just Coors Light, Bud Light, and, a 12 pack on Friday was gone by Sunday morning, just me. I could drink 12 beers by myself, and that caused more inflammation and more weight gain.
Yeah.
And, the heaviest I was during that. Even my wife didn't know how much I was drinking. She would see some of the bottles, but it became one of those things almost like a closet alcoholic. My father was an alcoholic for years. And, I would go out to my shed and I would put liquor out there in the shed because I didn't have to keep it refrigerated. And I started to joke with some friends. I'm like, my lawnmower won't start without a shot. Like, I have to take a shot before I start my lawnmower. Like, that's how bad it was.
Oh my gosh.
I just found things more enjoyable when I had a little buzz. But then, I'd start at 10 o'clock some days on the weekend, and I wouldn't stop till I passed out. And I'd wake up and sometimes start again the next day. And I'd take a break sometimes on Sunday. But, if there was some sports on, I'd have a couple beers and be like, it's okay to have a couple beers while I watch sports. And then I'd take a break like midweek because I almost felt like exhausted from it. But it was 5 to 6 days out of the week I was drinking, and it wasn't just one or two drinks. It had to be 4 to 6 every night. I had to get into a buzz, and
Wow.
I still have to be very careful. I have a friend who really got into bourbon, and that's kind of why I've kept some of this stuff, is just to talk about it. And it was a problem, and it didn't help the psoriasis. It didn't help my joints. It didn't help the way I was feeling. It made it all worse, as a matter of fact, and just made me get super heavy. I don't know. I sent you some pictures. There was a before and after.
I'll put them on the screen so people can see the before and after.
I think that was the one on the left. The before picture was New Year's Day of 2020. I didn't get to my leanest until I think it was 2022, somewhere around there. But on my own, I really just doing my thing that I knew to do. I changed my health a lot. But even after that, so that's part of the story, is like even cleaning up my diet, eliminating the alcohol. I was eating the best. I was in the best shape of my life. I was down to I think I got down to 9% body fat. And that is really hard if you've never done that before. So I was confused, like I'm doing all the right things, but I'm still struggling with this fatigue, this pain. This doesn't make sense. So I went to my friend. She's a nurse practitioner. And I said, Regina, if I didn't know any better, I think I have Lyme disease because I've been an outdoorsman. I've been bitten by ticks throughout my entire life. And of course, everybody asked the question, well, did you get the bullseye rash? Well, I'd pull up my leg and go look at my skin. I can't tell if I got a bullseye rash. I can't tell if this is psoriasis or a pimple or a bug bite or a cut. Like, it's very difficult to tell because my legs were pretty covered from the knee down. And of course, they did the testing and it came back negative. But now I know that type of typical traditional testing is like 60% false negative. And they made me go to infectious disease and all that stuff. And they're like, no, you don't have it. It's psoriatic arthritis. I'm like, okay, then let's take some x-rays and really do some more blood work. And of course, they take the x-rays and rheumatologists are like, well, you got some osteoarthritis, but we don't see any psoriatic arthritis. And what is the problem? And they still were like, it's psoriasis. And I think with, a lot of other things, I was like, you know what? I'll try the biologic because I was desperate. I didn't know what else to do. And so we tried a biologic, and dude, that stuff was strong. Like within 2 weeks, my skin was 98% clear. I remember saying to my wife, if this is that strong, I wonder what else it's going to do to me, long-term wise. And I think it was a September when I started that January. It wasn't, but maybe after my second injection. That January, I was still struggling with that fatigue. The joint pain was still there. My skin looked great. I was like, holy crap, this is like, my skin looks fantastic. But everything else was still the same. And I was struggling. As a matter of fact, I started getting worse from an emotional standpoint, to the point where I felt like if I would just get quiet and close my eyes for a moment, I make it emotional.
It's okay. Everybody cries on my podcast. I cry on my podcast.
Yeah, I could see a grave
Yeah.
dug out ready for me. And I just felt like at any time somebody's going to push me into that grave. And that was it. I was dying. I called my wife. I was stuck in traffic going to work. And I called her and I was like, something's wrong. Something's bad, bro. I didn't know any better. I think I'm dying. And at that time, our son was very young, and all I could think of was him. That's why I get so emotional.
Yeah.
I felt like my life force, my soul was just being slowly drained, and I wasn't getting answers. And the things that I was trying wasn't helping either.
Yeah.
And I just knew something was wrong. I felt like since I wasn't getting the answers myself, I needed help. So I kept searching, and I found an integrative physician. I swear, when I went in, I probably talked for 30 minutes straight without shutting up.
Yeah.
The guy just sat there listening, and he looked at me and he said, you either have Lyme disease or you have mold exposure. And I said, probably both, because my father's house has mold, and we have a cabin that I know has some mold that needs to be remediated. I said, which one's more expensive to go after, and which one's, the hardest to deal with? I said, Lyme. So we went that way, and we did some tests. It was a urine test. I had to go get either a massage or a really hard workout. I felt like a massage was more enjoyable.
To provoke it, yeah.
So, learning more about this bacterium it can fool your immune system. And that's why people have a hard time finding it.
Yeah.
It'll encapsulate itself and go dormant and just sit there like in a shell until you have some kind of event in your life, like stress or trauma. And boom, it breaks out and just runs rampant on you. It can develop little flagella, which are like tail-like structures, and literally outrun your white blood cells, run away from them so they can't catch them. And then they go into your connective tissue, and they'll burrow into your connective tissue, and then they'll eat your collagen while they're in your connective tissue and destroy your ligaments and your tendons and your joints. That's why people have a lot of joint pain with this too. And
I've heard it can burrow into really any tissue. It can be your kidneys or your liver or your brain. That's why a lot of people with MS, actually, I think 80% of people who have MS, they did a study, and 80% of the people who came in tested positive for some type of Lyme. And it destroys your whole body, and it shows up differently in everybody, which is the hardest. Yeah,
it's
because
very hard to diagnose and pinpoint.
it mimics so many other diseases.
And people get diagnosed with all kind of crazy neurological things. They were just going along the line of psoriasis and psoriatic arthritis because I already had that. And so they just kind of swept me into that. Incidentally, there's a friend, my next door neighbor from like high school. His son started dealing with some crazy neurological stuff. And, my brother had mentioned Lyme disease because of what I had dealt with. And one of the first things that thankfully one of their physicians checked was for Lyme disease. And he was positive for Lyme disease on the traditional testing.
Oh, wow.
All of the other doctors were like, no, this is not Lyme disease, and we won't treat that Lyme disease. They would not prescribe him antibiotics. They started doing brain scans. He started having neurological problems with his vision. Like he would lose his vision out of nowhere. So they're doing all kind of eye testing. I'm like, y'all got to go after the Lyme disease. It took weeks before they really were like, okay, we think this is like his parents were like, we need to really go after the Lyme disease. It's hard because medical doctors will typically prescribe you like a lower dose of antibiotics instead of just dumping it on and trying to kill the bacteria. And that, unfortunately, sometimes that process of dealing with those antibiotics is rough. Incidentally, there was a miscommunication between my provider and the pharmacy. My provider wanted high doses of antibiotics for a short period of time, but the pharmacy wrote it at a lower dose for a longer period of time. And I didn't have a follow-up in time, and that's what I ended up doing. So for like 4 months, I'm taking antibiotics, all these supplements, and I was also taking some antifungals to go after the mold.
Yeah.
And I'll tell you that, like, it ripped up my digestive system. that being on stuff that long. And then, when I got back with him, he's like, oh man, I didn't even know what had happened. He didn't know there was communication. I feel better. So, whatever it was, we worked it out, but it was 4 months worth of pretty intense, diarrhea and dealing with that kind of stuff.
Yeah.
And loads of supplementation. With that process, I knew I needed a change. My family became more important to me. I knew I wanted to spend more time with them. And so the clinic I was with, I was trying to get more flexibility. And it was about a 3-month process of trying to work with them on more flexibility. And I was like, I can't renew my contract this way. I was seeing, 120 patients a week and just long 11-hour days. And finally told them I had Lyme disease, and they decided that they would hire somebody to replace me instead. And so it was kind of a blessing in disguise. It was a little frustrating because I'm like, man, the pandemic already kind of showed a lot of people your employer doesn't care about your health. And then to have that to happen, it's like, yeah, your employer doesn't care about your health, even as a small business. So it sort of forced me to go back into private practice. And it's been one of the best things ever for us, just from a flexibility standpoint. Some things have happened with my young son where he was in the hospital ICU for 7 days, and we were there with him the whole time. And we got sick with what he had, so we were all down for like 3 weeks, and I would have never been able to do that working for somebody else. So that flexibility is what I was desiring, and it's what I have now. And I'm at that point where I'm like, okay, this is what I want to be able to teach and share with people. I want to share with them that what you're going through, there are answers. We can find those answers, and it's often outside of traditional medicine. I've been studying functional medicine as a result. That's a lot more intense than I had expected, with trying to rebuild my practice, rebrand myself, and being a father. And he's nonstop and growing like a weed. But now I'm adding in new workouts. I was such a basher. Anytime somebody said I'd do CrossFit, I was like, oh man, here we go. Because I just knew, like, back when CrossFit really became popular, all the sports medicine journals were like, it's not a matter of if, it's a matter of when you're going to get injured. And then I would see it in my practice. I was taking care of these people afterwards, and I'm like, man, this CrossFit is stupid. They're doing too much. And now that's what I'm doing. Like, I realize, what? I want to try something really crazy, and I'm enjoying it. Now, I don't go all out like some of the times. A lot of times they put on men's and women's weights. Sometimes I'm picking the ladies' weights. I told somebody the other day, I was like, I probably should have started this like 10 years ago, when I was 30 something instead of when I'm pushing 50. Like, don't start CrossFit when you're nearly 50. But it's been fun. So the soreness now that I have is because of this, more intense workout. But look, there was no way I could do this workout years ago. And even before I thought I had Lyme disease, I would work out even intensely. And at the time, I was telling people that I thought I was having a neurological response to the intense workout. But now I think it was actually Lyme disease. And I think I've had it more than just that, past few years. I think I've had it for a decade or maybe even longer than that.
And that's something I actually still struggle with, is like the post-exertion malaise, where I do something, I work out, and the next day I start to feel sick, or something neurological happens. And you got lucky with just like doing one round of treatments and getting better. There's people like me and other, I think women, I don't know, women just have it harder. I don't know why. I think it's our hormones, and just, we do have a little bit more fat on our body. I wonder if all those toxins can get stored more deeply into our fat tissue. But yeah, I mean, I'm obviously like way better than I was, but I don't think I could do CrossFit right now. That'd be hard for me. But
one of the only reasons I do it is because the gym's 6 minutes from my office. And with my schedule now, I can get in there early, I can get it done, I can get home about the time my son's waking up, and then I can go on. I'm doing twice a week fairly consistently, getting in a third time a week. I really want to get to 4 times a week, but it's tough. Like, do I have soreness and fatigue and exhaustion afterwards? Absolutely. But it's hard for me to tell, is that because of this hard workout, or is that post Lyme type stuff. But I agree with you. I
Right.
got really lucky with just it was probably a full 6-month process of the medication and supplementation. And then I just started tapering stuff off. And the last time I went to see Brandon, I was
Oh,
like,
you see
hey,
Brandon
I
too?
do. Yeah, I see Brandon.
Okay, yeah, I do too.
He's a cool guy. I'm
Yeah.
jealous of him and his hair. When he first walked in, I was like, look at this
Oh,
guy's hair, man. It's beautiful.
he's my favorite. I always blow him up because we can like message him on the portal
Yeah,
and
I got to
stuff.
be careful not to do that too for myself. Him and I, like at the point now, I almost like told him, I said, I kind of want to start biohacking now. I mentioned I'm getting close to 50, I'm 47. So I'm like, I want to be able to be as fit and feel as good as I can for as long as I can. We had kids really late, and we could do a whole nother podcast on fertility and things like that. Men are easy. There were some problems with me. We were able to fix that quick. Wife, we still don't know what was happening, but we ended up having a child naturally. But we found out the day that North Carolina went into lockdown in the pandemic that we were pregnant, and we had been trying for many, many, many years. And
Wow.
now he's
Praise the
4,
Lord.
and I'm absolutely, praise the Lord. It was totally a God thing, and that's kind of what we had to do, was just give it up to God and just accept that. I actually got to the point where I was like, we're going to spend all that money on fertility. There's a lot of children that need a good home, so I wanted to adopt, and I was looking into that, and I had kind of given up on having a child myself, and it's like, we're going to adopt. My wife kind of got to the same place, and we almost just let it go, and then when we let it go, and it happened, I get emotional again. Oh, my son, he's the best thing.
You're
He's
gonna
so
make me
fun.
cry.
He's the best thing
Yeah.
ever. We'll have to have a whole nother uh, fertility crying podcast over that.
Yeah.
He's
So it's
I'm 47. He's about. I'll be 48. He'll be 5. So I've got a lot of years to try to keep up with this kid. By joking, I'm like, by the time he's going to college, I'll finally hopefully be able to retire. But I don't know if I ever want to retire completely. I always want to
yeah.
feel like I'm doing something, helping people.
Yeah. It
I got
seems like, sorry to interrupt you. It seems like my career is definitely I'm getting a lot of patients who are struggling with fertility, and we do the mycotoxin and the mold testing and it shows positive, and it's like we need to get rid of this mold first, and then boom, like they conceive. Or like with the men, I'm like, well, it can be also your husband, so we need to figure out uh what's
guys
going
are
on with
easy.
him.
Always start with the guys.
Yeah. You probably just need more vitamin D and testosterone.
Yeah.
You're good.
Yeah, yeah, and that's it. And then ladies, it's not that easy now. Yeah, there's so many blessings that have come within all of those challenges, and it's opened my eyes. Like, I really keep telling myself I need to keep delving further into the Lyme disease to be able to recognize it and help more people, especially as I learn the functional medicine and grow
Mhm.
that aspect of the practice, because you can do telemedicine visits a whole lot easier than having people come in and reach so many more people. But Brandon actually warned me. He was like, don't do it, because you'll just because you had Lyme, you'll freak yourself out to the point that you may think, I'm never going to get better. And so that's what I just kind of told myself. I asked him one day, I said, how do we know it's gone? He said, there's no test for a cure. So you never know if it's gone. And I don't want to keep retesting myself to see if there's any bacterium present, because I'm just accepting it. Like, I feel good. And I know that I can just have one day, I'll have what I consider a flare. And a lot of it due to food. I still notice that. And one day, if I just wake up and I feel like junk and I'm sore and swollen and I'm like, I didn't do anything, and I just got to accept it and just know that I was able to get through those days when I was at my worst. So this is
Yeah.
nothing like that. I pray it'll never get like that again. But now I recognize it enough. When I have those days, I kind of accept it and do what I can do and make sure I pay attention to what I'm eating and staying away from the inflammatory type foods, and just go,
Yeah.
okay, get yourself back and do this. And then, usually in a day or two, I'm back to good. So yeah, honestly, with the medications too, I'm off all medications and stopped them all. I'm like, I don't want to take them anymore.
Yeah, I think I took some antifungals for a while because I had really bad mycotoxin poisoning. Like all of the markers were like in the red zone. But I would go on and off of them because I'm like, I didn't feel good while I was on them. And I'm like, I'd get like my skin would burn, my joints would swell up. And, Brandon was saying it's a die off reaction, but I don't know. I just didn't want to do it. So I just, now, like you said, well, first, I did want to say this too. People who have not experienced what we've experienced just have no idea. Like when you were getting a little bit emotional about thinking about death and stuff, like the way we feel, especially in like the depths of the chronic illness, is just completely hopeless, and nobody believes us because we look fine. And no, there's no blood markers showing up, so the doctors are telling us we're fine, so we feel like we're crazy. We literally are losing our minds and nobody can give us an answer. And that, I think, is the worst part of the illness, is that nobody believes you. And so like you said, there are some days I flare up, but I just take it as a rest day. I'm like, I look back at the week, I'm like, you know what, I did a lot this week. I'm dealing with a lot with X, Y, and Z. I didn't eat the best. I'm just going to rest and nourish myself and sit out in the sun and take some deep breaths. And then usually either that night or the next morning, I feel better again. So stress has a lot to do with it too. And I definitely have to say no to a lot of things sometimes just because I know I'm going to need that time to rest.
Did anybody ever say to you during and even now, like, do you think counseling would help you?
Yeah, so well, it was funny because I was seeing a Christian counselor at the time when I was really sick. And like during that time, I could really only do a couple activities a week, like maybe go to the counselor or like, I don't know, go for a walk or something. Like I was just so sick and fatigued. But I was like explaining to my counselor, I'm like, there's something wrong. And she even agreed with me, which was interesting. She's like, no, I don't actually think it's in your head. I think you should keep searching. I think you should keep seeing what's wrong with you. But she said, but I don't want you to ignore the other things that are going on that we need to work on. Because there was a couple things in my life that had happened that was really traumatic. And so she's like, we do need to focus on this, but definitely keep searching. But then when I would go to the doctors, they're like, you have anxiety. But it's weird because I got diagnosed with POTS and I showed positive for lupus. But when I would go to my primary doctor, he was like, you have anxiety. And I'm like, I'm so inflamed. Like I have like these other diseases that are showing up. Like
And
there's
now I'm
something.
anxious because I don't know what's going on. I don't know how
I'm
to deal
like,
with this. And yeah, exactly.
yeah, I'm like, of course I'm anxious. I'm
Yeah.
like, I literally can't. I was failing school. I had to drop out of school. One of my jobs fired me, and the other one was gracious enough to just like kind of let me come and go as I could. I mean, I couldn't even like my motor skills. I couldn't like if there was something on a piece of paper and I was like trying to work, I couldn't memorize like let's say 1, 2, 3, 4. I would go 1 and I'd type it in the computer 1 and 2. Like it was, I just felt, I don't even know how to explain it. Like thinking back to those times, I can't imagine feeling that way again. Like my thoughts, I had tons of intrusive thoughts too, which was terrifying. But most of my thoughts were just like screams. Like I had that brain buzzing or brain itching, and like my thoughts were just like screams. And it was the most terrifying time of my life. And I think that was mostly due to the mold exposure, which again, it was interesting. I had a doctor tell me I had mast cell activation syndrome, and she would give me an EpiPen because I was like breaking out in hives and my tongue was swelling up. And I went to go talk to my sister, and I'm like, look, there's something wrong with me, because she was like, you're crazy, you're crazy. And I'm like, my doctor gave me an EpiPen. Like there's an issue. Like, and I think it's the mold in the house. And she finally was like, okay, we should probably look into this. They just this week they tore apart, like, and I get it. My mom is dealing with some health issues too, but there was more mold in the house than we even expected. Like it is everywhere, and like all of us struggle with health issues, especially mental health issues. So it's been quite the eye opener. And I try not to I don't want to fear monger people at all, but mold and even Lyme are two things that are so overlooked and not accepted in the Western medicine world. And I think it's because, well, one, they weren't taught, but two, these things are so challenging to navigate. Like as a practitioner, I hate to tell people like you either need to move or you need to spend hundreds and thousands of dollars remediating your house. Like, because that's tough. That's not something easy to suggest your patients to do, but it's true. Like I tell people, run, don't walk when it comes to mold. Like you have to get rid of it or you have to leave. Like it's the only option. Because if you're constantly being exposed to it, you're never going to get better.
Yeah.
And even with the Lyme too. So I think mold, I think that what happened with me, I was living in mold. I had contracted Lyme disease, but the mold suppressed my immune system so much I couldn't fight off the Lyme. And then kind of like we talked about, it creates those biofilms and it embeds itself and it lays dormant and all these things. And then when I got COVID is when it all exploded. And
I think so too for me. COVID
yeah,
was like the pain that I was having with my COVID. I thought that I was having that. That's kind of why I thought maybe it was long COVID because I was having the same kind of pain and the
yeah,
fatigue with it. And I'm with you. I think that COVID absolutely triggers in people underlying issues that they had. And
yes.
many people didn't know it. And my buddy had cholesterol problems and it just made his just body explode. And he didn't make it actually.
Mm.
But yeah, I think that COVID really stimulated that. I think my body had been, like you were talking about, suppressing it. It's interesting that I kind of got on that route because another friend of mine who hunts the same area started having this crazy like arthritis type pain. And
Interesting.
he had been told by a nurse practitioner that they thought that he had an underlying tuberculosis infection and
Mm.
then got bit by the tick and something happened with that with the Lyme disease. And so he ended up having all that same kind of stuff. But that kind of got me thinking, well, maybe the psoriasis, my body's been, I don't know if psoriasis was related to Lyme disease in the past or if I got infected with Lyme later. But then with all that just stacking on top of each other, and then when COVID
Yeah.
hit, it was just like I felt like I never felt the same after I had COVID.
Yeah, I think that's exactly right. With all the people dealing with long haul COVID, I think it's actually an underlying infection of something else.
Something else.
There have been some other studies, but even like the EBV and stuff in the Lyme, and there's just so many things that can become chronic, and it's really hard to navigate all of that. But what we're running out of time, but I wanted to ask you one more thing, and it's just what can people do right now if they're in the midst of a chronic illness? Like, what can they do to give themselves hope?
And just keep searching. You just gotta you gotta take your health into your own hands and just keep searching. And if you don't feel like people are listening to you, find somebody else. And you said something. My wife was very understanding, even though she didn't get what I was dealing with. I would talk about it so much that she was like, something is not right here.
Yeah.
And I think there was a point where she was almost not believing me because of how bad I was feeling. But even today, when I describe it to some people, and I had somebody go, "Really? Really? You really felt that way?" Like, yeah, bro. Like, and it just like they couldn't even comprehend feeling that way, like you thought you were going to die. And it's not all in your head. It can create that feeling like it's all in your head because
Yeah.
nobody's listening to you. But, as much as I trust my fellow doctors and traditional medicine, you're right. There's only so much that they can do because it comes back to the pharmaceuticals. If they can't find the drug for it, then they really struggle. And they have a
Yeah.
resistance, it seems like, to even think outside or even suggest to somebody, I might not be able to help you. We might need to go this route. And thankfully, things like functional medicine and what you're doing, like nutritional treatment, integrative practices like we've been to that take, traditional medicine and combine that with whatever you want to call Western medicine. I just kind of think it's a more open mindset of let's stop being narrow minded and understand that there are still things that we don't understand. We don't understand everything about the body. And let's just keep looking until we find something. And sometimes you just have to keep trying stuff. There's not a test for every condition that we have. There's not a test for every bacteria.
Yeah.
The Lyme disease itself is becoming an epidemic that people still don't even want to admit to. You get into conspiracies of it being biogenetically engineered and stuff. And then what happens with COVID is quit effing with these viruses. I know they are creating viruses so that they can study them and to create drugs. It's kind of strange. We can go down a whole another thing. The COVID, they were experimenting with this, and they already had a vaccine, because you have to have the vaccine before you're experimenting with these viruses. And then they get out, and now they already have the drug in place, and all they got to do. That's how they got it manufactured so fast. But that's a quick blurb on some conspiracy there, which is now found out it's true. It's true. So that's it. Just talk to some different people, and just know it's not in your head, and just know that it's not this. I think I've heard you even say it before, like your faith is not strong enough is why you're sick, and that's not it. Like you probably have to do some searching in your faith and to help keep you strong through times like that. And and just continue to ask for prayer and pray for yourself and pray for answers, and just keep going until you find it, and try nutrition and try different diets. And I think I'm going to try some animal based.
Do it,
because I view it as like an elimination type diet. I don't want it to be my lifestyle.
Just do meat and fruit.
I have a hard time with, because I know we're omnivores, so I have a hard time not getting vegetables. And it's about to be spring here, so we're about to plant our garden, and I absolutely love the vegetables that come out of our garden.
Do the non-toxic, just do like cucumber, zucchinis. I can't do tomatoes. I can do it every once in a while, but not
from our garden.
Nightshades.
Yeah, from our garden, I like it, but I can tell it.
I wanted to say, when I was in like the deep parts of being sick, I just begged the Lord to, I was like, Lord, when I wake up tomorrow, I'm going to be 100% healed. You're going to heal me. You're going to heal me. I believe it. And I'd wake up and I wasn't healed. And that went on for probably a couple months. And I finally broke down. And I said, Lord, you're not going to heal me. Not in a miraculous way. At least I really came to an understanding of all right, Lord, instead of asking the Lord for what things I wanted, I asked him what he wanted from me. I asked him, what are you trying to teach me through this? How can I learn more about my body so that I can get answers? Give me wisdom, give me discernment. And that really changed my walk with the Lord through all of that, because it turned into God being this magic genie in my life to me actually having a deeper connection and relationship with him of all right, Lord, you're here with me and I know you are, and you're going to sit here with me whether I'm sick or not. That's sufficient. Understanding that his presence and what he did on the cross for us was sufficient for us. And it just completely changed my faith and strengthened it. And I'm so grateful that I went through what I went through, because now I can help other people and you can help other people. And
that's right.
Yeah.
Going through this definitely gives you a different level of empathy for people.
Yeah. Oh yeah. Totally different compassion for people.
Sometimes you feel like, I know exactly what's wrong with you, but
I know. So people, just Wednesday night, I had some friends, they're like, I have this issue going on. And I was like, parasites. And I'm like, wait, I can't.
It's hard. It's hard because, not everybody's open to it.
No.
Some people don't want to know that they've got something like that in them. And many of our conditions are related to parasites, a bacterial infection, and what we still don't know what those things can do to us, and they're feeding off of you.
Yeah.
And
that's what parasites are.
Yeah. That's right. They feed off you. One thing they've not got good at, like viruses have not got good at not killing their host, right? They feed off and destroy you until you're dead. And then fortunately they are dead, but they haven't evolved enough to not kill you, but so they can slowly kill people, and they can go their entire life struggling. But I feel like for at least me and probably you the process or the going through all of these things have led you down a road to help more people, but also empower yourself and educate yourself. It's made you a more intelligent, more empathetic, and more faithful person in that entire process.
Yeah. That's good. That's good. Well, thank you so much, Dr. Jonathan. It's a pleasure having you on here. And I look forward to, we'll definitely do another podcast. We can
We
talk
got to,
fertility. We
yeah.
got to do fertility. That'll be fun.
I think we got like months worth of things we can come back and talk about one and then another and then we can probably have one a month and talk about just between.
Yay. I know. Yeah, for sure. So we'll keep in touch, but thank you so much for coming on, and we'll talk again soon, okay?
I'll see you at the office.